So, good day everyone. So, we are now in chapter 8 and it is entitled The Impact of Information Technology on Productivity and Quality of Life. So, let's start in IT investment and productivity. So, let's define productivity. It is the amount of output produced per unit of input and it is measured in many different ways. So, productivity in factory might be measured by the number of labor hours it takes to produce one item, while productivity in a service sector company might be measured by the annual revenue of employee generates divided by the employee annual salary. So most countries have been able to produce more goods and services over time, not to the proportional increase in input, but rather by making production more efficient. So these gains in productivity have led to increase in GDP based on the standard of living because the average hour of labor produces more goods and services. So let's define innovation. So what is innovation? It's a key factor in productivity improvement and IT has played important role in enabling innovation. Progressive management teams uses IT as well as the other new technology and capital investment to implement um, innovation in products, processes, and services. In the early days of IT in 1960s, productivity improves were too easy to measure. For example, mid-sized companies often had a dozen of or more accountants focused on solely on payroll-related accounting. When the business implemented automated payroll system, fewer accounting employees were needed. So these productivity gains from the such IT investment were obvious. So today, organizations are trying to further improve IT system and business processes that have already gone through the several rounds of improvement. So organizations are also adding new IT capabilities to help workers who already have an assortment of personal productivity applications on their desktop computers, laptops, and smartphones. So instead of eliminating workers, IT enhancement are saving workers small amounts of time each day. Whether these saved minutes are actually result in improved work's productivity is matter of debate. Many analysts argue that the workers may usually the extra time to do some small tasks that didn't have to do before, such as respond to small they would have otherwise ignored. But the following list summarizes additional factors that can affect national productivity rates. So one is labor productivity growth, which differ according to the where the country is in the business cycle, expansion or contraction. Times of expansion enable firms uh, to gain full advantage of economies of scale for production. Time contraction present lower investment and opportunities. So outsourcing can skew productivity if the contracting firms have different productivity rates than the outsourcing firms. Regulation make it easier for companies in the United States to hire and fire workers and start and end business activities compared with many other industrial nations. This flexibility makes easier to the markets to relocate workers to more productive firms and sector. So, more competitive market for goods and services can provide greater incentive for technological innovation and adoption as a firms strive to keep ahead of competitors. So, in today's service-based economies, um, it is difficult the real output of such services as accounting, customer service, and consulting. So IT investment don't always yield tangible results, such as cost savings and reduced headcount. Instead, many produce intangible benefits such as improved quality, real, reliability, and service. So as you can see, it is difficult to quantify how much the use of IT has contributed to the worker productivity. Ultimately, however, the issue is academic. There is no way to compare organizations that don't use IT with those that do. So, because there is no such thing as non-computerized airlines, financial institution, manufacturer, or retailer. So, business people analyzes the expected return on investment to choose which IT option to implement. But this is the point trying to measure its precise impact on workers. Productivity is like trying to measure the impact of telephones or electricity. So let's define telework. So what is telework? Telework, also known as telecommunication or telecommuting, is a work of arrangement in which an employee works away from office, at home, at a client office, in a hotel, literally anywhere in a telework. An employee uses various forms of electronic communication, including texting, email, audio and video conferencing, and online chat. So teleworkers access the internet via smartphones, tablet, laptops, and similar devices that retrieve computers files to log on to software application, access or corporate database, and communicating with fellow employee, managers, customers, and suppliers. So the goal of telework is to allow employees to be effective and productive from wherever they are. So organizations should prepare guidelines and policies to define the types of position and workers who represents the ideal telework opportunities. Clear guidelines must set for how and when work will be given and no collected from teleworkers. If the certain hours during which teleworker must be available, there's too much to be defined. Employee work expectation and performance criteria must be also determined. Lastly, is the um, consumer report found that while the majority of teleworkers, or 62%, were positive about teleworking, nearly 25% felt teleworking had no real impact in their lives, and the other 13% of teleworkers reported a negative impact of the telework. The negative feelings were primarily because of workers felt that teleworking had not really improved their productivity. So in addition, many teleworkers felt that there was increased pressure to work outside the normal business hours, so that they now work longer hours, thus taking time all away from their family.
The digital divide. Digital divide is a term used to describe the gulf between those who do and those who don't have access to modern information and communication technology, such as cell phones, smartphones, personal computer, and internet. There are roughly 2.4 billion internet users worldwide, but the worldwide distribution of internet users varies greatly from region to region. The digital divide exists from country to country and even within countries among age group, economic classes, and people who live in cities versus those in rural areas. For example, in India, while 20% of urban Indians are connected in internet, only 3% of rural Indians are connected. In United States, Hispanics and Africans Americans, adults living in poor households, and senior citizens are least likely to have internet access. Many people believe that the digital divide must be bridged for a number of reasons. Clearly, health, crimes, and other emergencies could be resolved more quickly if a person in trouble had easy access to communication network. Access to IT and communication technology can also greatly enhance learning and provide wealth of educational and economic opportunities, as well as influence cultural, social, and political conditions. Much of the vital information for people need to manage their career, retirement, health, and safety in increasingly provided by the internet. The Education Rate Program has created through the Telecommunication Act of 1996. The full name of the program is the School and Libraries Program of the Universal Service Fund, E-rate helps schools and libraries obtain broadband internet service to advance the availability of educational and informational resources. The E-rate reimburses telecommunication, internet access, and internal connection providers for discount or eligible service provided to school and libraries. Schools and libraries must apply for the discount, and the USAC works with the service providers to make sure that the discounts are passed along the program participants. A University of Chicago study examined the impact of the E-rate program in California and found that the number of students in poor schools going online had indeed increased dramatically. Researchers conducted that either school did not know how to make effective use of internet, or that internet use has simply not a productive way to boost test scores. Despite the fraud and lack of evidence of a positive impact on student test scores, the $2.3 billion per year E-rate program continues today. Low-cost computers, as noted above, it is estimated that as of June 2012, nearly 2.4 billion people worldwide have access to internet. Although that the number is impressive, it still leaves nearly 5 billion people, 72% of the world's population, unconnected. What most of those 5 billion people have in common is low income. Increasing the availability of low-cost computers can help reduce the digital divide. One laptop per child. The nonprofit organization One Laptop Per Child has a goal of providing children around the world with low-cost laptop computers to aid their education. Classmate Plus. In 2006, Intel introduced a low-cost laptop called the Classmate PC. This first generation of this notebook computer costs under $400 and has designed for use kindergarten through high school classrooms in developing countries. Raspberry Pi. The Raspberry Pi is small, inexpensive computer developed by the Raspberry Foundation in United Kingdom. It is about the size of a credit card and about the price of $25 to $35. In digital divide, some industry observers identify the increasing use of cell phones as an important first step in bridging the digital divide in many countries. The rapid and widespread use of cell phones has resulted in an increasing investment in infrastructure required to support wireless communication. Cell phones come with a wide range of capabilities and costs, but are cheaper than personal computers. Some users simply purchase a SIM card, essentially a memory chip that holds the owner's account information, including his or her phone number and contact information, and then swap SIM card in and in out of a shared cell phone to lower costs even further. Cell phones are more portable and convenient than the smallest laptop computer. Cell phones comes with an extended battery life, much longer than any personal computer battery, which makes the cell phone more reliable and in regions where access to electricity is inadequate and non-existent. As the cost of technology and monthly usage fees decrease, even more people will be able to make this upgrade. And when they do, they will gain access to thousands of applications and websites that they can use for business, educational, and personal purposes. When IT is available to everyone, regardless of economic status, geographic location, language, or social status, it can enhance the sharing of ideas, culture, and knowledge. The impact of IT on healthcare costs. The rapidly rising cost of healthcare is one of the 21st century major challenges. U.S. healthcare spending hit an estimated of $2.7 trillion in 2011 and expected to increase an average of 6.3% per year. a rate much higher than overall inflation. Between 2015 and 2021, according to the Centers of Medicare and Medicaid Services. Although many new diagnostic procedures and treatments are at least moderately more effective than their older counterparts, they are also more costly. In addition, even if new procedures and treatment cost less, for example, the magnetic resonance imaging, they may stimulate much higher rates of use because they are more expensive or cause less discomfort to patients. Patients sometimes overuse the medical resources that appears to be free or almost free, thanks to the share of medical bills that is paid by the third parties, such as insurance companies and government programs. A patient who doesn't have to pay for a medical test or procedure is probably less likely to consider its cost to benefit. Attempts by insurance companies to rein in those costs have led to a blizzard of paperwork but have proven largely ineffective.
The rapidly rising cost of healthcare is one of the 21st century's major challenges. U.S. healthcare spending hit an estimated $2.7 trillion in 2011 and is expected to increase an average of 6.3% per year, a rate much higher than overall inflation between 2015 and 2021, according to the Centers for Medicare and Medicaid Services. Although many new diagnostic procedures and treatments are at least moderately more effective than their older counterparts, they are also more costly. In addition, even if new procedures and treatments cost less, for example, magnetic resonance imaging, they may stimulate much higher rates of use because they are more effective or cause less discomfort for patients. Patients sometimes overuse medical resources that appear to be free or almost free thanks to share of medical bills that is paid by third parties, such as insurance companies and government programs. A patient who doesn't have to pay for a medical test or procedure is probably less likely to consider its cost to benefit ratio. Attempts by insurance companies to rein in those costs have led to a blizzard of paperwork but have proven largely ineffective. So the cost of healthcare is a significant challenge in the 21st century, with US spending reaching $2.7 trillion in 2011 and expected to increase by 6.3% annually between 2015 and 2021. New diagnostic procedures and treatments are more effective but more expensive, leading to overuse of resources. Insurance companies' attempts to control costs have been ineffective, as patients often overlook the cost to benefit ratio. So the impact of it on healthcare costs. Electronic health records. As of 2005, the healthcare industry only invested about $3,000 in IT for each worker, compared with about $7,000 per worker in private industry generally, and nearly $15,000 per worker in the banking industry. However, the healthcare industry has now greatly increased its investment in IT, spending over $88 billion in 2010 alone to implement electronic health records (EHRs), convert to a new coding system known as ICD-10 for diagnosis and inpatient codes, and begin use of a new Food and Drug Administration web portal to report deaths and injuries caused by medical devices. It can be extremely difficult to pull together the paper trail created by a patient's interactions with various healthcare entities to create a clear, meaningful, consolidated view of the person's health history. In some cases, medical personnel are simply unable to locate paper medical records, This lack of patient data transparency can result in diagnostic and medication errors, as well as the ordering of duplicate tests, which dramatically increase healthcare costs. It can even compromises patient safety. The healthcare industry has significantly increased its IT investment, spending over $88 billion in 2010 to implement electronic health records or the EHRS, convert to ICD-10 for diagnosis and inpatient codes, and use a new Food and Drug Administration web portal for medical device reporting. This increased investment can help improve patient data transparency, reduce diagnostic and medication errors, and reduce healthcare costs and safety. An electronic health record, or the EHR, is a computer-readable record of health-related information on an individual. An EHR can include patient demographics, medical history, family history, immunization records, laboratory data, health problems, progress notes, medications, vital signs, and radiology reports. Healthcare professionals can use an EHR to generate a complete electronic record of a clinical patient encounter. Data in a EHR can then be easily accessed by other healthcare technology for Economic and Clinical Health Act. High-Tech Act was passed as part of the $787 billion 2009 American Recovery and Reinvestment Act economic stimulus plan. High-tech is intended to increase the use of health information technology by requiring the government to develop standards for this nationwide electronic exchange and use of health information. Second is providing $20 billion in incentives to encourage doctors and hospitals to issue EHR to electronically exchange patient healthcare data, and the third is saving the government $10 billion through improvements in the quality of care, care coordination, reductions in medical errors and duplicate cares, and last is strengthening the protection of identifiable health information. Under this act, increased Medicaid or Medicare reimbursements will be made to doctors and hospitals that demonstrates meaningful use of EHR technology. An electronic health record, or the EHR, is a computer-readable record for health-related information including patient demographics, medical history, and more. The Health Information Technology for Economic and Clinic Health Act, or the High-Tech Act, was passed to increase the use of health information technology by developing standards, providing incentives, saving the government $10 billion, and strengthening the protection of identifiable health information. It also includes increased Medicaid or Medicare reimbursements for meaningful use of EHR technology.
Good day everyone, this is Nino Rico Lucas. The topic that I will discuss is all about the impact of it on healthcare costs. We have telehealth utilized technology to deliver healthcare remotely, including consultation, training, and administrative support technologies like internet, video conferencing, and mobile apps are commonly used. However, using SMS text message for patient communication poses HIPAA compliance risks, leading developers to seek more secure alternatives. Another is telemedicine delivers medical care remotely, allowing patients to access treatment without travel. It expands healthcare reach and efficiency through store and forward, live telemedicine, and remote monitoring methods. We also have store and forward telemedicine. Collect patients' data such as image and videos for later evaluation by medical specialists. It doesn't need simultaneous patient care provider interaction but enable timely intervention based on gathered information, potentially preventing critical situations. While live telemedicine involves real-time interaction between patient and healthcare providers through video, video conferencing, allowing immediate communication and assistance for instance in remote location like oil rings. Live telemedicine connects on-site medical personnel with off-site specialists for prompt emergency care. Therefore, remote monitoring, also known as home monitoring, involves regular tracking of vital signs and health indicators like glucose levels, with data transmitted to healthcare providers. This method helps in early detection of health issues, especially for patients with chronic condition who may overlook warning signs, for instance, sudden weight gain in a congestive heart failure patient called signal fluid retention, alerting physicians to intervene before a crisis. Approximately 2.8 million people globally utilize home monitoring device in 2012. And lastly, medical information websites for lay people. Medical information website for lay people provide accessible resources on various health topics, aiding individuals in understanding healthcare service and managing their well-being. While these sites offer valuable information, they are not substitutes for professional medical advice, diagnosis, or treatment. Users are encouraged to consult qualified healthcare providers for personalized guidance. Additionally, online tools from healthcare providers, employers, and insurers offer insights into hospital quality, treatment costs, and coverage options, empowering patients to make informed healthcare decisions.